I've been part of a working party and we've been involved in getting consumers back into a community setting, generally in aged care facilities or mainstream residential care facilities. Back in October 2012, we had a couple of consumers on our unit that approached the consumer advocate. Their request to her was to get me out of hospital. They'd had lengthy admissions into hospital and they wanted to look at what other options were available. We had a 32-bed unit. We had identified 20 consumers in the unit that had been there greater than a 2-year period, and basically just started to work through the process of, in consultation with the consumers, where to from here. The big thing I think is really making sure that the consumer is housed in appropriate accommodation with the supports that are required for that person. And again, it's on an individual basis, that person-centred care. It's around what that consumer needs. We'd go in and do education sessions in the nursing homes. We'd troubleshoot, so some consumers would actually go on like a respite period, and our staff would phone on a weekly basis and just troubleshoot with the facility. Well, these are the problems that they're having, this is how we'd manage it. Eventually we were able to relocate 19 so far out of the 20 consumers identified. Some have returned to their place of origin, which sort of Griffith area, Wagga area. We had one lady that went interstate. Her daughter and son-in-law lived in Melbourne and she wanted to be with them in Melbourne. Some of the families opposed sort of transferred to the community, and we had one fella that had been in hospital for 49 years, and the family, they identified this as his home, and he had been admitted back in the 1960s, and we understood fully that it was a difficult transition for them. We had extensive meetings with the family involving senior staff from the unit, senior management from Kenmore, the medical staff, and really trying to support the family that his needs could be met elsewhere. So we did site inspections with the family just to sort of reassure them, and again reiterating the support of the community team so that they knew that he wasn't going to be totally discharged from the mental health services, that there would be that backup community support and reviews with the psychiatrist. He's living in a local nursing home, 100-bed nursing home, doing really well. He was followed up for quite a long period of time. I think sort of initially it was visits every other day, eventually cut down to weekly visits, monthly visits, regular psychiatric reviews with the psychiatrist. We're to the point now that this consumer isn't even case managed by mental health services. They certainly have access through our 1800 number, our access line, and if they require input from mental health, but you know, he's doing really well. The feedback I get, so that's great. Yeah, after 49 years in a psychiatric facility, I think it's a good outcome for him. Yeah.